Hello, everyone. My name is Petra Straight. Welcome to this episode of Coffee with FIP, a pod-style mini-series designed to provide pharmacy professionals around the world with a dynamic platform for informal, evidence-based, and CPD-aligned discussions on key and timely topics in pharmacy that reflect FIP's strategic priorities and programs. Please note that views and opinions expressed in this episode do not necessarily represent FIP's official position on the topic unless explicitly stated. The episode is planned around the theme Vaccine Access in Emergencies, How Pharmacists Step In. And with me today is Eko Kobayashi. Hello, Eko.
Hi, my name is Eiko. Thank you for being here. And I'm a pharmacist in Japanese Red Cross, and now I'm working for the IFRC, International Federation of Red Cross and Red Crescent Societies. Thank you.
Thank you. And we also have Barbara Skorolik Velera. Welcome, Barbara.
Hi, Petro, and thank you, FIP, for the invitation. So yes, my name is Barbara, and I worked and have worked for different international humanitarian organizations along the years, and I'm a humanitarian pharmacist. So thank you.
Thank you, Barbara. Today, we will be discussing the role of pharmacists in delivering vaccines when chaos strikes, be it conflict, natural disaster, or disease outbreak. From maintaining cold chain integrity where infrastructure is fragile to maintaining supply chains and delivering vaccines, pharmacists are critical in emergencies beyond just dispensing medicines. Vaccination in emergencies is critical to help prevent deadly outbreaks, protect the vulnerable from getting sick, and safeguarding the longer-term recovery from a disaster. I thought we'd start this off by just discussing from your experience, what specific roles do pharmacists play in vaccine access and delivering vaccines during emergencies?
Should
Barbara,
you?
do you want to?
Yes, I can start. Okay. Well, I think we all know that in most countries, of course, this varies. Pharmacists are one of the most accessible healthcare providers in many communities. It's more widespread and readily available to find a pharmacy as compared to maybe a hospital or a clinic. So, pharmacists are really at the forefront and they're face to face with the community, especially during emergencies when the hospitals are filled with more emergency patients. A lot of people will maybe opt to go to the pharmacy for minor afflictions. So pharmacists really have a great connection with the community and can provide not only services, but health education in this process. And during an emergency, that's really important where people are lost and maybe they don't know what to do or where to go.
Yeah, I agree with that. And also, I'd like to share 3 points based on my experience of managing cold chain. It's a crucial point for vaccines. And on emergency sites, pharmacists can contribute to implementing flexible cold chain management based on their knowledge of the characteristics of vaccines, local situations, such as available equipment and resources. So I believe this quality assured flexibility is beyond the capabilities of doctors and nurses. And one more thing, so in terms of emergency preparedness, pharmacists can play a key role in planning the procurement of quality assured vaccines and cold chain equipment. In particular, when the situation is like usually we have constraints on the electrical power supply.
Thank you both. It's interesting there. You've both sort of touched on some of the challenges and the barriers to vaccine distribution and emergencies. What do you both see as the most common barriers to vaccine distribution?
Well, picking up from Echo's point, I think logistics is one of the key barriers of getting the vaccine, but also maintaining it in a good quality. But I'll let Echo, she'll probably have much more to say about that. Also, just access to vaccination points, be it for because the roads are blocked or the access because there was a flood or something like this, or because of conflict situation during an emergency. Access is also usually a key issue for healthcare in general. Um, and then just public mistrust, depending on the context. They might not trust healthcare providers, or there might be other situations at play that need to be considered.
And also, I have faced many challenges because of the inadequate cold chain management system due to insecure power supply conditions and lack of equipment and resources, and also lack of knowledge of the cold chain and related equipment. So, and also because of no presence of pharmacists during especially community health activities. So meaning a lack of frontline involvement with beneficiaries. So which result in a lack of awareness of the actual situation regarding cold chain management. And it can lead to quality assurance disruptions at the end of the supply chain.
Yeah, that just sounds really difficult to try and cope with. Both sides of those things, the access, mistrust from the population, all these logistical challenges. As pharmacists, how have you been able to address them, or how have you seen other pharmacists addressing these challenges and barriers?
Well, I think in the humanitarian space, we try to work with governments to create systems that maybe were not planned in the law initially, but to ensure that they're still complying with all the regulations. For instance, what I've seen is um, almost like transformation of pharmacists into mini hubs, for instance, for vaccination. That we saw that a lot in COVID, where we had to quickly expand our capacity, but this would also be true in emergency situations where pharmacies that weren't normally used for vaccinations, they're used as a place for people to come and get vaccines. They're probably not fully equipped to maintain a vaccine long term, but they can be used temporarily for instance, a team to come in and use that space so they can provide vaccines to the population. It's way more accessible than having everyone come to a hospital, for instance, or come to a clinic because the clinics will be full of other patients. So that's something that I've seen that's worked really well. We also have, of course, some locations in some countries where pharmacies are equipped for vaccinations from the very start. So that's, of course, a lot easier if that's the case because they will have all the capabilities. But even if not, pharmacists are very resourceful. So we can transform the pharmacy into a lot of places, including for distributing vaccine. But if that's not possible, for just providing education of where the patient should go and what's important to consider during the time of that crisis.
Yes. And I think we can do also contribute in advance as part of preparedness. So we can provide the BCP, the business continuity plan for the electric power outage. And also we can provide the training courses on cold chain management because on emergency sites, it's very important to understand all stuff, how the cold chain is important to be maintained. So, and then for electric power supply, so we need those professional staffs to support. So I think it's very important to provide the knowledge and share the importance of the cold chain to keep the valuable vaccines should be quality assured.
Awesome. It sounds from both of you that, although we're talking about this from the perspective of humanitarian pharmacists with a lot of experience, that this is something, really relevant to all pharmacists, that, it is something that every single one of us could sit down and consider what would we do if there was a disaster or some kind of crisis in the area we live and understand how we can work and what our legislative abilities are in terms of pharmacy, but also to make these plans and make sure we have business continuity in place and we've really thought through what the options are so that when a disaster does hit, pharmacy is organized and ready to serve and to help the populations who are around, whether they are new populations or the existing population. And I think that sounds like something that's really important for all of us to take away from this conversation. I'd be really interested from your experience, what skills or approaches make pharmacists really valuable in emergency vaccination efforts? What are our special things that we're bringing to the table as pharmacists?
Yeah, I would say I think keeping with the theme of our both our points, I think from the side of being that hub for patients, pharmacists really develop communication skills with communities, understanding what's happening and being able to identify the problems so they can also scale it up and try to address the problems, but also communication skills with each individual that comes into the pharmacy and being able to support that person at a much more in that person's environment as opposed to when a patient comes to a clinic. I think they already feel so inhibited by coming, and sometimes they don't even go because they're scared or they had bad experiences before. So we really develop as pharmacists that communication skill to all sorts of individuals. That's really a very important skill to have.
Yeah, I totally agree with that. And also I'd like to emphasize, so I think pharmacists should be more direct involvement in entire supply chain because pharmacists are responsible for ensuring the efficient and appropriate provision of quality assured vaccines as a specialized profession. So from the preparedness period to on-site in front of
So,
the beneficiaries.
yeah,
Thank
it's
you.
interesting. It sounds like pharmacy bring a really good mix of, sort of skills based and that softer skills side of things and dealing with people and different organizations and, dynamic problem solving. But we also bring that technical knowledge of, the quality assured of vaccinations and how we maintain the quality of vaccines till it gets to our patients.
Yes, for sure.
Yes.
Um, but thank you both. I think there's actually a lot to take away and for pharmacists to consider and think about, derived from your experience in working in this area and things that everyone can do to make vaccination in emergencies something that they would be able to do and would be great to support and, really improve the quality of health in the communities that we work in, particularly in these humanitarian settings. So thank you very much for joining. Um, I
Mm.
so I think in terms of these key takeaways for vaccination and humanitarian emergencies, it sounds very much like, we need to get involved as pharmacists. It's something we shouldn't be afraid of. We bring a very specific range of skills and knowledge to the service and to enable people to access it. It also sounds like the preparedness work is very important for pharmacists to consider what that would do if this happened somewhere where they were living, how they would react, and how they would be able to facilitate and enable vaccination in emergencies. So I'd like to thank you very much for listening to this Coffee with FIP episode. Please check out the FIP website for more resources and episodes.